Russ T. Shimizu. I'm a physician and neurologist specializing in vascular disease and dementias, strokes, dizziness, and seizures. I've been out in practice for probably, let's say, around 43 years in private practice in neurology. I've been a clinical professor at the UCLA and at USC, and I'm in private practice at the present time. This video I'm giving right now is in relationship to transcranial Dopplers, which I use. And I've been using this transcranial Dopplers probably, it first started in 15 years ago. And today, with the new technologies, we've been able to improve the transcranial Doppler. I use it predominantly in patients who I feel that I need to evaluate their vascular system within the brain, and it's an easy way to evaluate the brain vascularity without having them to be in a MRI scan, or if they can't have a MRI scan because of a pacemaker, I can still evaluate their vascularity within the brain, especially for stenosis and emboli. I've also used it for patients who I feel that may have basovertebral artery insufficiency and a subclavian steal syndrome. I've used it extensively now, and it's been of great help to me and to my patients. They don't have any side effects. I've never had a patient complain about having this test done. It's not stressful also to the patients. And I would recommend transcranial Doppler to all my colleagues, and they can, they'll find that it's extremely useful in helping your patients, especially in a degree of anticoagulation. One thing is that we can now stent arteries in the brain, which we couldn't do before. And so now, if you find a stenosis, you can follow up with an MRA if they can have one, or a CT angio if they can have one. So it's an excellent screen, just like people use a duplex scan of the carotid arteries. It's just very similar, but now we can extend it into the brain. The best part about it is that my patients have no difficulty having the test. I've used it also for migraine patients looking for cerebral spasms, vascular spasms, and emboli. It's very good for detecting emboli. And that is one aspect that we can perform now, which in the past we didn't. And so that's another aspect when you're looking at the brain. When we see white matter disease, or we feel like that may be embolic, you can use transcranial Doppler. And they do use transcranial Dopplers in the hospital, when they're monitoring patients when they're doing vascular surgery. So this is now available as an outpatient. I would highly recommend it to all my colleagues, and I think you'll find it very helpful for decision making, and also providing our patients with a much better diagnostic evaluation for their symptoms.